good morning and welcome. Women Warriors Network are delighted to host this very interesting and relevant event for Pip Health, Systematic Patient Engagement in Pharma, the launch of a portal. So how can pharmaceutical companies make sure that they engage with patients in a systematic way in order to make sure all is co-created with and for the patient? So founder and managing director of Pip Health, Nadine van Dongen, will talk us through the focus of this event being systematic patient engagement. For 13 years, Nadine van Dongen is working on ways to give patients a voice on healthcare. She founded the first international patient intelligence panel named Pip Health after a life-changing car crash. We would also like to welcome Anneleen Vindevogel. Anneleen will take us through the reality of patient engagement projects within Janssen, who is known to be a front runner in patient engagement. We will also hear from breast cancer survivor Sinead Scott-Lennon, who is a resilience and recovery coach. So I will start by introducing Nadine. So very welcome, Nadine. I'll hand it over to you.
Thank you very much, Sandy. Amazing to have this event. And so thank you, Sandy, for organizing this event with Women's Warrior Network. You are my inspiration, both business and personal life, as you are a real, true warrior. You are organizing events for businesses, and I'm really grateful that you set up this event in 4 weeks' time. And so thank you very much for that. So when I was preparing for these events, I took like a big piece of paper and I wanted to draft the flow of this talk. And in the middle of the paper, I wanted to write portal, as we're launching this patient intelligence portal in this event. However, something stopped me and I wrote improve patients' lives in a big circle and added a little heart because that's just the way I am. And I knew then that I had to connect this, that improve patients' lives is connected to this portal, but I couldn't draw it out so easily. So it wasn't that easy. And for it to become clear, I will take you on a little journey, and not a little journey, I'll take you in a journey through time. So I'm taking you 17 years back. So it started with a crash. I would kind of had the title of this. Some of you know the story already, and some don't. So I'll shortly tell you a little bit of my story. So imagine a Nadine, 17 years younger, and working at Pharma company in the Netherlands. So I'm driving from Tilburg to Amsterdam, and a car hits me on the motorway, and my car flips 3 times through the air, and an empty ambulance is driving by and is the first to notice me, and they save my quantity and also my quality of life by putting me immediately in a coma. And in my recovery, I had to learn to walk again, and I was struggling living with nerve pains. And thanks to my friend at the pharma company I worked in, I got information about new pain treatments out there. So that improved my life with that knowledge because I could get better treatment. But also I realized I was so lucky that I was so close to pharma, and being so close, that is valuable for me as a patient then. So that was a bit my light bulb moments. And that light bulb moment then turned into a concept thinking. So then I created the concept of patient intelligence, where I try to get people to become more patient intelligent. And through that concept, I developed the vehicle for that, and that's patient intelligence panel. So that's a panel where patients join, and they can then share their voice in patient projects. So in 2008, I started the company Pip Health, or Patient Intelligence Panel in Health, and we started working on the patient engagement projects. So patients give their insights to Pip Health. We then give those insights in reports to pharmaceutical companies. They pay us, and we then donate money to charities and healthcare organizations with some insights, so that the charities can give better care, and the pharmaceutical companies can develop better treatments or health solutions, like patient support programs. So working in all these projects with patients for the last 13 years, it's very clear that we've got a common aim. So all the pharma companies have this common aim. So improve patients' life. Remember the bubble I drew in the beginning preparing this talk? So improve patients' life. So with an aim like that, so if all these pharma companies have an aim to improve patients' life, you would think that their IQs or their PIQs, patient intelligence quotients, are high all around.
All processes for working together with our own patient network were clear and standardized. And on the other hand, we increased the available patient pool by setting up a partnership with Pip Health. And we choose for Pip Health because of our shared mission, better care for patients. So if we as Janssen become more patient intelligent, we make these decisions that are in line with what patients really need. We will invest in the right projects and create more value and less waste. So better care for patients. And I would love to share some key takeaways from this partnership. It's very critical to embed the concept of patient intelligence in the entire organization. All teams and different roles have responsibility in this. It's not going to work if we consider it as something only for the patient engagement and advocacy team.
I think I only ever had an understanding about this, and I think we've all been a patient at some stage in our lives, unless you're very, very fortunate. And I only ever learned and had an understanding was through Nadine with her business as she was building her business. And seeing the collaboration between Nadine and these, you know, these amazing big pharma companies, it's what's definitely going to push it forward for patients, for us in the future. And surely it's going to make the world a better and greater place with your help. So thank you. And, you know, even seeing the iceberg, I like seeing the visuals of, you know, your slideshows of both of what you've both been showing to give us as the patients an understanding. So thank you very much. That was wonderful. And I mean, here and now, we've just heard from two businesses working on patient engagement projects, but let's get a patient's perspective. So Sinead Scott-Lennon is a breast cancer survivor, and she'll tell us more about her journey and her years ahead with ongoing treatment, with hopefully the support she needs and deserves. Welcome, Sinead.
Hi there, how are you doing? Can you hear me?
Very good.
Good. Hi, everybody. And a bit like Anneleen, my voice is slightly gone, so I'm equipped with lots of tea and stuff.
Would you say your support on your journey? So would you say there's been pharmaceutical, from the treatment sides?
Sorry.
Support, because you call Macmillan and you call, you know, like other NHS services that were provided to you. Was there other services provided to you for support from pharmaceutical, from treatment related?
No. So I think that's something that's really interesting, Nadine, and I may as well address this now, that I am on some really difficult medication. Obviously, chemotherapy is difficult. If anyone's been on it, you know it's difficult. Radiotherapy, you know, feels easier, but it's still not great. And they have long-term side effects, okay? And tamoxifen, and the combination of tamoxifen and Zoladex. I can't even begin to describe what those side effects are like, but they are a daily challenge. Okay, I'm delighted to be here. I'm fully grateful, but I have no contact with. I have no idea who the pharma companies are behind those medications. I have had to after I finished radiotherapy, it's almost like you fall off a cliff, right? It's like, well done, you've got through chemo, you've got through radiotherapy, start taking your daily meds and come in every month for this nasty injection, and off you go and live your life.